There's my baby.
Hello everyone, I am Melissa Bondi.
I'm Dana Denha, and this is Adventures in Parenthood. Throughout this series, we'll explore the world of raising kids from newborn through adulthood.
Emergencies strike when you least expect them. There are ways that you can be prepared, and you just have to trust you act and react when the situation does arise properly. So yes, I had a situation myself where two of them, I'll make it short and too sweet and to the point.
Okay.
But yeah, one instance I had to call 911, and then in another instance I didn't, but it was a choking situation. So regarding the 911 call, that was, you've got a really young baby, and they came, 911, those who came out, the paramedics and the EMT, they came out, it wasn't needed, they weren't needed. Thank God, for the situation, but they were amazing and definitely put me at ease, self-assured, everything was okay, so I can say that.
And this
properly.
was when the egg allergy came up when
Yeah.
you called 911, but it's better to call and not need them to not call, and then if you did need them, it would be too late.
Right, and I have to say that, and I know we may touch on this in our interview today, but I had that slight hesitation where I thought I was going to be embarrassed.
Yeah, like am I being like an overbearing mother? Yeah.
Or I thought I was going to be embarrassed. I was going to be the mom that called, the 911 came out and wasn't necessary. And I got over that real quickly though, and they did come and I was like, oh my gosh, they just put you at ease. So that was so nice. Yeah, and as far as the choking, again, one of those situations where there was some crackers that were stuck in the throat. She's 9 months old. I gave it to her, and I thought one at a time, but when I wasn't looking and turned my back, there was multiple in her mouth. So there was multiple crackers, and I think they were not soft enough, so they went down the throat. Next thing I know, her eyes are big, they're watery, she's not saying anything, and I'm like, oh my gosh, and I had to get her out of her chair. Luckily, she coughed it up herself, and I didn't have to do, holding her over or doing any type of, what do you call it, with the chest? The
Heimlich.
The Heimlich. I didn't get to that point, thank God. But yeah, those are two instances I had, and I know other mothers and fathers have probably had them, but I'm not ashamed. It happened. I'll talk about it. But yeah.
I actually had an instance where Keaton it was the first time. It's funny because she could care less to eat these now, but I gave her Velveeta shells and cheese, and it was like, she was like just shoveling them, like, and then all of a sudden she's like, and I just like, because they are like, they're strapped in, like she's buckled into her seat, and then there's a tray on top of them.
Yes.
So then it is like a panic situation. So I just like hooked it out, and I was able to get it out, and like, but she was already kind of like about to throw it up, I think, more than, and it's not like crackers where like it was super soft, but
yeah.
She was just like shoveling in too much food at one time. And I think that is like a normal thing that like almost everyone that's a parent has to deal with at one point or another.
Yeah, I've heard tortilla chips, and I've heard, be aware. Just even if it's soft, still be aware that, like you said, Velveeta shells. So, yeah.
Joining us is Jason Trojan, Community Relations Coordinator for Emergent Health Partners. Welcome to the show, Jason.
Yeah, thank you guys for having me.
So you heard a little bit about what we were talking about. I'm sure you deal with this stuff or hear about these stories all the time. Can you give any advice to parents that may deal, like just to start off, that might be dealing with something like that with their child?
Especially with the choking,
Yeah, absolutely. And kind of like what you touched on, like emergencies are very intimidating and they're overwhelming. So it's totally natural to like in that moment kind of pause and not know what to do. So like kind of your first line needs to be like, okay, like is there anything that I can immediately do in the moment? And today I think we're going to offer people some kind of tips and things like that they can do in that immediate aftermath. And then also, like you did, calling for help. Because if you're on the fence and you're not quite sure if it's an emergency or not, like you're better off erring on the side of caution and calling for help. Because that's pretty common on the ambulance. We'll get calls and sometimes we're needed, sometimes we're not needed. So at the end of the day, if you made the phone call, like we'd rather come out and make the evaluation, especially for something like choking. Like, maybe like unless you have that level of training, you might not know exactly what's going on. So we'll show people kind of how to, perform some of these life-saving type interventions, and then also kind of how to prepare people too. So.
Okay. Do you want to fill us just in real quickly about your background and what you do with Emergent Health Care?
Yeah, absolutely. So my role with the company is I do community education and outreach work. So particularly, I actually do a ton of work with kids. So I run programs for kids as young as like 3 years old, all the way up through, teenagers and adults. So a lot of what we do with kids focuses on teaching them about like who the EMTs and paramedics are and just other first responders, and in case they do have interactions with us, because a lot of times when they meet people on the ambulance, it's not always under the best of circumstances. It's an emergency. So getting them familiar with us. We talk a lot with kids about calling 911 and preparing them for emergencies, what to expect on a 911 phone call, like those types of things. So I do a lot of that type of work. I do work on the ambulance as well. So usually on the weekends I'm out running emergency calls and things like that. So I do get to see some of this stuff and kind of offer some of my knowledge.
Okay. So. I'd like to know, you mentioned like teaching kids how to call 911.
Sure.
What's a good age where you should really be like hammering that into your child? So
and it's tough because kids are always different. Some of them will pick it up, and one of our biggest challenges now has kind of been the emergence of the cell phone. It used to be you pick the phone off the wall and it's got these nice push buttons that you push. Now with smartphones, like there's this process of unlocking the phone and getting to like some of the screens have an emergency button. So kind of getting them used to your phone. So as soon as they're ready, because kids like, I don't know, I feel like my nephew's already, he's 3 and he's already playing with phones and kind of gets what they are.
Oh yeah.
So, it's like once they get to that point, show them how to unlock the phone. And, teaching when it's appropriate to call, too, because that will happen as well, with kids. Like, once they learn how to call, like, they might just be picking up because they think it's fun because they watch Paw Patrol that day and they think that they want to call 911. So, making sure they know when it's appropriate to call and when it's not appropriate to call, and teaching what an emergency actually is. So.
Well, and I'm sure you guys don't get as many, like, fake calls. I remember as a child, because, you had the phone there and it was like you'd play with the phone. My sister calling 911 by accident, like not knowing. You probably don't get those kind of calls so much anymore because of the cell phone, and it's like not like a phone that you can just like
press the button.
Yeah.
Yeah, I was going to say it is tougher. They do have the emergency button though, so sometimes it's easy to like kind of hit that by accident. Luckily on the ambulance side, like a lot of those get sorted out before we get there. I'm sure law enforcement deals with that a lot more than we do. They'll kind of triage out some of those calls and figure that type of stuff out. But I'm sure it still happens. We don't see it quite as much. So,
yeah. So one of the big things we were going to talk about today is CPR, and we're going to talk about, well, let's start with like adult CPR, but can you kind of explain what CPR is and why we should all know how to do it?
Yeah, so basically what we're trying to accomplish with CPR, and what we really want to do is we want to get it simplified down to a level where everybody's ready to react in these types of situations. Because like we mentioned before, they're very intimidating. So, we've really simplified down the training so that we can, get the community actually doing chest and compressions. Because cardiac arrest, that kind of like disruption of the heart activity, so when the heart's not moving or pumping blood and those types of things, like unfortunately a lot of people aren't surviving these types of, events. And the reason why that happens is because people aren't doing early CPR. Because when you're not pushing on somebody's chest, basically they're laying there without blood circulating. So there's really been a big emphasis with chest compressions, and we've heard about the hands-only CPR movement that's out there now, where we're encouraging people, if you see somebody go down, even if you're not sure what's going on, depending on your level of training, you might not be trained on how to recognize when somebody's actually not breathing or doesn't have a pulse. So if you see them go down and you're not sure, like go ahead and start doing your chest compressions. If you start pushing on somebody's chest and they are conscious, you're going to get some sort of a pain response back from them, and then you'll know that it's time to stop pushing. But you really can't do damage doing that. Like you're not going to hurt people by doing this. So like encouraging people to do the hands-only CPR is kind of where we're trying to go with that.
What age would you say we should get started in learning it? Like, is this like a teenage?
I teach kids as young as like 4 or 5 years old.
Wow.
CPR?
So, yeah. So like, now here's the thing. Like at that age, they're not physically capable of doing
they're not strong enough.
They're not strong enough. And like CPR, and like when we do it later, I'm sure you'll see that it's physically challenging, especially keeping it up. But they can get the concept to it. So if they can start, at a young age and they figure out how to do it, that way when they do get to a point where, because it's not a hard skill. That's the other thing. Like once you get the idea of where to put your hands and how fast you need to push. That's about it.
Okay.
So, I teach little kids, and like they love it, and like it's always fun to see the little guys get down and start doing chest compressions on the mannequin and stuff like that. So.
Okay. Well, do you want to? Why don't we go down and
Yeah.
we'll do some
Show people how
on the
to
go.
perform
Grab our
CPR.
friends here.
So while you guys are getting ready, you can get down. I'll
Yeah,
just ask
okay.
you a question here. So we got trained in 2015, but you should actually be doing it, every 2 years, getting retrained on it?
Yeah, so the certifications typically last 2 years.
Yeah.
So, so that's kind of depends because there's a couple of different like certifying type bodies out there. Like the certification lengths could be different depending on who you go through. But it's important to keep it up. So.
Yeah, because I felt like after we did the training, I was like, I felt like confident. I'm like, yeah, I did. I felt good about like my ability to do it. But then I also was like, okay, let's say something happened down the road. Do I still feel confident a year from now? Like, because I've only done the training once, and I'm like, do I remember?
Yeah.
Would I remember?
Yeah.
Yeah.
And that's where, you can really take it down to like a simple level. Like, worst case scenario, if you can't remember anything else, like, always protect yourself, make sure that the environment that you're in is safe. Always make sure that you're checking them for a response.
Right.
Make sure you're calling for help, and then start doing chest compressions. And if you can get to that level at least, then, those are kind of 4 simple things that everybody can kind of remember. So.
Well, I can absolutely shadow what she just said because we did the training here. It's been over 2 years, and when we were doing this earlier, I do remember, putting the hands like this. I remember the song you're supposed to. But if it really happened right now and something happened here at our building, say in an hour, I'd be very, I don't know how I would be. I can't predict how I would be, but I can tell you right now it gives me a little anxiety to think,
Sure.
oh my gosh, I might have to do this in real life. But in our class, it was great. We all did it, and it was,
Yep.
it's one of those,
Yeah.
you have to practice.
Sure,
You take
absolutely. And
courses.
unfortunately, there's nothing you can do to prepare for that moment. It's going
Just
to
have
be
a
scary.
mannequin at your house,
Yeah, I was going to
practice
say,
nightly.
and you can practice on this as much as you want to, and then in the when the
not
real
the
thing
same.
happens, it's totally different.
Yeah.
So it's expected to have that little pause.
Yeah.
And like you're going to kind of have that little moment where you're not going to know what to do. But that's why simple, right? Keep it simple.
Keep it simple.
Yeah, get to the simple steps and get moving with that type of stuff. So.
All right, so
Okay.
why don't you show us?
Sure. So what we're going to go through is we're going to kind of go through how we would approach and like the types of things that we need to be establishing. We talked about scene safety, so we want to make sure that we're walking into an environment that's safe for us.
Okay.
Make sure that whatever happened to them can't happen to you too. Because
Okay.
on the ambulance side of things, if we have, there's a big difference between us having 2 patients and 1 patient, right? So make sure that you're protecting yourself. You're going to want to establish a response. The easiest way to do that is just come up and tap them on the shoulder. Are you okay? Are you okay? And look for a response of some kind. Now, if somebody is unresponsive and they don't respond to your touch, if they don't respond to your voice, at that point you can assume that this is an emergency, right? Because even if they are breathing, if they have a pulse, this is still a medical emergency of some kind. So make sure that you pick up your phone and call 911.
Okay.
Okay? So you can check for breathing, so take a look at the person. Easy way to do that, you can do the look, listen, and feel. If you want to come down, if you want to open their airway up a little bit here, take your fingers, put it on that jawbone, and just tilt their head back.
Yep.
And look down at their chest. We're looking at their chest. Is their chest rising and falling? Okay, we're listening for air coming out of their mouth. And you can feel it on the side of your cheek, too. If you can't discern obvious breathing, go right into doing chest compressions. Okay? So, heel of your hand, this part of your hand right here, goes right on their sternum. Okay, that kind of lower part of the breastbone there.
Yep.
So we're going to place our hand. You're going to straighten your arm out. Okay, so both arms are going to be straight. And you got to take all of your body weight and put it up over the top. This is going to help you when you push. You use that weight from your body to actually push down.
Okay.
Okay. Now, after we push, we have to let that chest come all the way back up.
Okay.
That's really important because think when you push down on their heart, they have blood in their heart, right? So if we don't let the chest all the way up, it doesn't allow the heart to refill between each push. So make sure that you let up between each push too. So now we'll go ahead and get into it, and we're pushing at a rate of about 100 per minute, 100 to 120 per minute. Ready?
Yep.
1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. So we'll just do 30 for now.
Okay, great.
So, if you have the training, you probably learned that it's 30 compressions, 2 breaths. 30 compressions, 2 breaths. for people that are just kind of watching now and they're just kind of getting the introduction, like just keep doing your chest compressions and try to keep them up as long as possible. Now after doing that, you feel a little bit tired
I
after.
do.
Yeah,
I'm a
I was
little
gonna
winded
say,
and I use some abs.
it's a ton of work. Yeah, if you
But
have a
I'm
CPR
sure in
mannequin
an
at home.
emergency you actually don't feel tired until maybe after.
Yeah, I was gonna say
The
like,
adrenaline's pumping.
you'll have your
and-
adrenaline pumping, and
Yeah.
that's going to help you get through it. But you still will get tired. So that's why if you have multiple people around, like even if they don't know how to do this, like have them switch with you.
Okay.
Like nobody should be doing this for more than a couple minutes at
Okay.
a time.
Okay.
So like kind of switch back and forth, use your resources, and try to keep this going for as long as possible.
Okay.
Now, if you know how to do the breathing, that's where you can have somebody helping you out, and you guys, one person be doing the breathing, one person doing the compressions. So that's like an additional level of training. So.
And we asked her earlier about the mouth-to-mouth.
Sure.
Is that?
Yeah, so mouth to mouth. If you have a barrier and proper training, it can be very helpful. Okay, they make little barrier devices. Some of them look like a mask that goes over their face, or some of them look like a little piece of plastic that just kind of sets over their mouth. That's for your protection, okay, because there are things that can spread, okay, and I've heard stories about people getting sick and acquiring certain things from doing mouth to mouth.
Yeah.
So if you have it, you can do it. Really with the difference, and we'll get into it, with kids it's really more important to do the ventilations. With
Okay.
adults not quite as important. Kids typically don't have like heart attacks and things like that that lead to cardiac arrest. So they're really going to need those ventilations a lot more than adults do. So yeah, if you know how to do it and you have the proper barrier, go for it.
Okay.
So
All right, Jason, we're going to take a short break,
Okay.
and we'll be back with more, and you can show us how to do the AED when we get back.
Hi everyone, welcome back to Adventures in Parenthood. We are talking with Jason Trojan from Emergent Health Partners about CPR and AEDs. Welcome back.
thank you.
So yeah, we have more to discuss and showcase. I know we were going to talk about
Well, first, what is an
AED?
AED?
Sure. So an AED in really simple terms is like sometimes we have this disruption of heart activity. So the way that I always put it is like your heart's just kind of sitting there and quivering like this. And when it's quivering, it's not pumping blood. So what these machines are designed to do, they're really simple. You push the button, they turn it on, and they talk. It's going to determine whether a person has a shockable heart rhythm like that. And if it finds that shockable heart rhythm, it's going to reset the heart by sending a bunch of electricity in. It would be the really simple way to put it. So they're very common now. We find them all over the place. They're in schools, they're in churches,
We have one
they're in
here.
shopping malls. Like
Exactly.
they're all public access for the most part, so anybody can pull one off the wall and use them.
Okay.
So if you see somebody that's unconscious, like go ahead. It doesn't hurt to hook them up to the defibrillator. And if they're unconscious and not breathing. So,
Okay.
Yep.
So do you want to show us how
Sure,
one
absolutely.
works?
So I mentioned that these are really simple. There's actually like, and mostly there's going to be like a little direction card here so that you guys can see that there's just a few simple directions. So we turn the machine on, and the machine's going to talk.
Apply pads to patient's bare chest.
So-
Plug in pads connector next to flashing light.
So we just listen to directions and we follow the directions. Now there's a couple patches in here. There's a set for
Apply
adults
pads.
and there's a set for
Plug in
kids.
connector.
Okay. We have to expose the chest because these are designed to go on bare skin. So
Will they
bring the
work through clothes?
No, they won't work through
Okay.
clothes. A lot of them will come with like a pair of scissors, so it's easiest just to like, cut the shirt up through there.
Yeah.
So
But you
when
gotta
do you
remember-
decide though, like you're doing CPR and then you're like, well, this isn't working, or?
I would put it on right away.
Okay.
Okay, so,
Apply
and
pads.
these can go on, like if somebody's doing chest compressions, I would hook this up around the person doing chest
Okay.
compressions. So.
And just, you just have to make
Yeah,
sure they're
so
not
the-
touching the person when you do the shot, if they need the shot.
Yeah, and the machine's going to tell you when to not touch them.
Yeah.
And you'll see here when I plug it
Apply
in.
pads. Insert. Apply.
Okay.
Do not touch the patient.
So that's when we'd stop touching them. It's analyzing now.
Shock advised.
So it found a shockable rhythm.
Charging.
So the machine's going to charge up, and then you're going to
Stay
deliver the
clear of
shock.
Patient. Deliver shock now.
So we want to clear everybody away. This is about to send a lot of energy into them, so we don't want to make contact with them.
Shock delivered. Begin CPR.
So after the shot goes off, what you're going to be doing, you can hear that beep there. That's your chest compression rate. So that's what that 100, 100 beats per minute or whatever. So you'll come back down, you'll start doing chest compressions with these patches still on. And then after 2
It'll
minutes,
tell you.
yeah, after 2 minutes, it's going to reanalyze
Yeah.
to see if it wants to shock again. So super simple, just turn it on. Listen
Yeah,
to the directions,
yeah.
right? So
Yeah.
So why don't we move into, can we stop the
yeah,
beep?
absolutely.
If we could, because you have like different methods for doing CPR for babies.
Yeah, absolutely. So we can show you the difference. With adults and kids, everything's the same. Okay. The only difference between adults and kids is going to be the amount that you push. With kids, we push slightly less because they're smaller. Okay. So the compression depth is different. With adults, you should probably be pushing about as hard as you can. With kids, push a little less. If they're a little kid, like use one arm. Okay, so that's going to be your difference. With babies, it's totally different, and I'll show you guys the difference with those.
Okay. So
So-
yeah, you brought a little,
Yep, so I got a little
Dummy
guy over
baby,
here.
yeah.
So let me scoot that off to the side.
and you wanted to mention that we're using the cushion, but typically you would not use a cushion.
Yeah, and that goes for, adult CPR too. You want to have them on a firm, flat
Okay.
surface. Okay, so like a good example would be like adult that's lying in bed. You can't do chest compressions in bed because there's nothing underneath
Yeah.
them, to kind of get that backward push, right? So yeah, we're demoing on the cushion here. Ideally, we want it to be on a firm, flat surface of some sort. So it's still the same thing. You're still going to be doing chest compressions. Okay, the biggest difference is we're just using 2 fingers. And that's going to go right at your top finger is going to go right at what they call the intermammary line, which is the line between the nipples. Okay, so my top finger sits there, and we're still doing chest compressions at the same rate, only now we're using 2 fingers. And that's the only difference.
Okay.
It seems completely different. This is going to be the really scary one. Working with kids and working with babies, these are very, very scary type
I don't ever want to
situations.
think about having to do it.
No, and most
Yeah.
people don't. So, but like I said, it's really similar, and that's kind of how you have to train your brain to think about it.
Sure.
So the other thing we wanted to talk about is choking.
Sure.
So why you have the baby out?
Yeah,
Why don't
absolutely.
you show us what we're really supposed to do in a choking situation instead of just going like this?
Yeah, I was going to say. So it depends. Like there's conscious choking and unconscious choking,
Yeah.
right? So with conscious choking, we use the Heimlich maneuver for adults and children. With babies, it looks different, and I'll show you guys that. With unconscious choking, whether it's an adult or a baby, it becomes CPR like normal. Okay, so you're doing chest compressions just like we were. Now, if they're conscious, what you're going to be doing is you're going to support baby all the time. Okay, it's really important that you're supporting baby and
And
protecting
this is
them.
what age or what weight and what age typically?
So we're looking at about a year and under.
Okay.
Because that's typically the easiest way. Like so, a year and under is when I say baby. For kids, I use the age 8. That's very subjective though, because kids come in all shapes and sizes. Okay, so if they're adult sized, treat them like an adult. Okay.
So am I gonna pick up a 2 or a 3-year-old like you're about to
No.
show us? Okay.
No, so for toddlers, like you're going to do the Heimlich maneuver, which we'll go over. So we want to protect baby. Okay, you're going to be putting your hand like around their mouth like this. You don't want to palm their face or anything like that because then you're clamping off their airway, and you want to protect them. So you're going to be delivering 5 back blows. 1, 2, 3, 4, 5. Support baby's head, and you're going to rotate over to the other arm, and then it becomes 1, 2, 3, 4, 5. Just like what we were doing with chest compressions, right? Like I said, the most important thing is to protect them while you're doing this. Make sure that you're supporting their head and neck, because I'm sure you guys know with babies, like their heads kind of
Yeah.
go all over the place, so you really do have to support them. And you notice I'm angling them down too. So I'm using like gravity to help me here because the food wants to go that way or the object wants to go that way. So angle them downward and just alternate 1, 2, 3, 4, 5. Rotate over. 1, 2, 3, 4, 5.
Okay.
And just back and forth until the object comes out.
All right,
So,
well, let's get you hooked up to this.
Sure.
I'm going to do the Heimlich on you.
Okay, sounds good.
So yeah, you've brought something to demonstrate.
Yep. So we talk about the Heimlich maneuver, right? So this basically is just a choking trainer. So what you're going to do is I'm going to kind of simulate choking here,
move
and
this
then you're
stuff
going to
so we
save me.
Yep.
So I have faith in you.
Oh, I've done this so many
Yeah, have
times
you?
before.
Okay.
No, I never once.
Well, you'll be fine.
And that's a good thing.
So like classic choking signs, right? We always look for people that, you know, everybody, the universal sign for choking is always hands to the throat, right? We go towards the object.
Yeah.
If you're truly choking, that means that you can't move any air past the object.
Right.
So that means if somebody's coughing, let them cough. Encourage them to cough up the object, okay? If they can't get any air past, if it looks like that kind of fish out of water type of deal, if you notice any color changes like blue, gray, that's loss of oxygen, then you can come up and start doing this. So we're going to get you up behind me.
Okay, so back up a little bit.
Yep.
We just want to get the best shot
Sure,
we can get
absolutely.
for you. Okay.
So you're going to put your arms around, and you're going to kind of put a foot between my legs there.
Like
That's
that,
in
okay.
case I collapse backwards on you.
Okay, we'd fall over for sure.
Yeah, so I want you to
Doesn't
rotate
matter.
your hand a little bit so that your fist is like this.
I can't see anything.
Yeah,
Well, like this?
Yeah, there you go. You got it. And then basically what you're going to do is you're going to go up and in hard to
Okay.
force the object out. There you go. So you guys can see she kind of popped the object out of me there.
But
So
sometimes you might have to do it more than
It
once.
might not have
more than likely you're going to have to do it.
to do it
Like,
multiple.
yeah, I was going to say, so you're going to keep doing this. And you want to use a lot of force. So you can pick me up off my feet if you want me, if you
Yeah.
want to. So
Yeah.
you definitely want to push hard to get the
And do you
object in.
find, because obviously we have a huge height difference, is it harder in that situation?
And it can be.
Yeah.
So
you can
there's-
take a seat too when you.
Okay.
Yeah.
So there's some special considerations. So first of all, if you can't get your arms around them, then you're going to have to potentially come up towards their chest to do this, which is totally fine. Same thing for pregnant women. Okay, so you have to come up and you have to do this on their chest. For little kids, you might have to get down to their level. So
Like
that
get
means-
on your knees or.
Yeah, so get down on your knees and kind of come down their level. It's the same type of motion, but you might have to come down to their level to do this. So.
Well, okay. Okay, so we can continue this. I know it's another show.
Yeah.
We're running out of time.
Sure.
I want to thank you. We both want to thank you so much for
Yeah, no
coming
problem.
on. This has been amazing.
Okay.
The demonstrations are key. I know it's so important for people to watch us and visualize.
Yep.
Thank you so much. For
And they
coming
can
on.
they can contact HVA and get classes.
Yeah, absolutely.
They
So-
can get CPR training and
We definitely offer
choking
CPR
yeah.
training, so we have certification classes. I do a ton of free community training for like nonprofit groups and things like that, so they can get
Perfect.
in touch. And happy to go over this stuff.
Perfect.
All right,
Yeah.
thank you, Jason.
Thank you
No
very much.
problem.
If you have an idea for a parenting show topic or guest, talk to us on Twitter and Facebook at #CTN Ann Arbor.
And for more great programming from CTN and our services, you can visit us on the web at a2gov.org/watchctn. And we want to thank you for joining us on this adventure in parenthood.